My next guest, Dr. Charles Simkovich, he's been in the business of reversing the issues that are caused by concussions. And he's been doing this for over 30 years with over 10,000 patients. And we're going to have him on right now. Dr. Simkovich, how you doing today?
Hi, Jason. Good. How are you, Jason?
Very well. I appreciate you taking time out for the show tonight. And I want to ask you about Tom Savage, the quarterback for the Houston Texans, who's obviously played his last college football season there in Pittsburgh. So I'm sure you're familiar with this situation and everything, correct?
Yes. Yes, I am.
All right, first thing I want to ask you about is some people took issue with the fact that when the spotters saw him take the hit in the head and the way he got up slowly, they took him into the locker room and cleared him for a concussion. But then later on at halftime, they did a recheck, and at that point they said the concussion symptoms did show. Is this abnormal, or is this basically NFL practices and what you're used to specifically with concussions?
No, a lot of times symptoms from concussion can be delayed, and they can even be delayed for days at a time. Anytime somebody's traumatized, fight-flight takes over and your endorphins kick in, and people can do incredible things. So as these leave your system, then other symptoms of an injury will show up. There are a lot of people who hit their head in car accidents sometimes don't even feel pain for weeks sometimes. So that's not atypical for that to happen.
I want to give a little bit of the background on your resume, because for those of the people out there that's not familiar with you, maybe there's some former NFL players that are listening right now, or other people that didn't even play sports but have suffered concussions and don't understand some of the side effects. Like concussions, can they continue to get worse without time, without being treated? And is there... Well, first, let me start off. Is there a treatment for concussions to, like I said, to reverse these issues and to get guys back or ladies back to where they were before sustaining the injury?
Yeah, there is, and that's what I've been doing for 30 years. And I can give you a quick history. And really, the way I see, the only way to really reverse the effects from concussion, it doesn't even have to be a concussion. It could be multiple cumulative effects of head injuries, such as in the case of like a Chris Henry or a Mike Webster. I think familiar with Chris Henry, the Bengals receiver
right,
who died, and they found CTE, but he had never had a reported concussion in his life, but he played football all his life. Essentially, I was involved in research back in the mid-'80s on cranial bone movement and the effect it would have on brain function. And our first focus was actually for learning disabilities. And what we found was all your cranial bones move in a very specific motion, and there's a whole dynamic that happens around this. But if you hit your head, it alters the movement. So it's going to have a direct effect on how your brain's functioning. Now, a particular concern is this pumping, the movement. It's an intrinsic movement. It pumps a fluid called cerebrospinal fluid around the brain. And once you have a head injury, it jams the sutures together, decreases the movement, so the pumping of the cerebrospinal fluid slows down and becomes inefficient. Now, that's critical because one of the main roles of this cerebrospinal fluid movement is it removes all the metabolic waste products that are produced in the central nervous system. In other words, it washes the brain. So you have a slowing of this effect, so the toxins stay in the central nervous system too long, and what that does is it actually starts to kill brain tissue. And I believe that's the problem you're seeing with a lot of these retired NFL players, like Junior Seau, like Justin Strelzik, like Mike Webster, like Chris Henry, and that's what I see in my office, every day. Right? Just this week, I had a 15-year veteran of the NFL quarterback start today, and a Division I football player to try to reverse the effects of this problem. So really, in my mind, and for 30 years, what I've seen is, unless you reestablish the normal movement and make the pumping of the cerebrospinal fluid normal or stabilized, a concussion will really never be healed. That's why I believe there was the term coined second concussion syndrome, which basically says once you've had a concussion, any subsequent concussions can cause greater damage quicker. And, I've maintained that it's only because that only exists because the first concussion was never treated appropriately and was never fixed. You don't hear that term in anything else in healthcare. I mean, there's no such thing as second broken arm syndrome.
Right.
Because the first one was taken care of.
Right, absolutely. Now, Dr. Simkovich, let me ask you this. So you're familiar with the way the NFL concussion protocol works and the track record of guys not being able to get back for that week's games. But let me ask you this. With what you do, it doesn't seem like it's commonplace in the NFL, but NFL teams are aware of it. And like you said, you've had numerous guys, retired NFL players. I even saw where a Hall of Fame player even said his whole career he wouldn't have been able to play as long as he did if it wasn't for your procedure and what you do to treat concussions. So if it's that talented, I mean, if it's able to do so much for players, why hasn't the NFL embraced this? And let me ask you this to go a little bit step farther with our situation down here in Houston. If the Texans would have gone out and sent Tom Savage to you, let's say Sunday evening or Monday, would he been able to clear the concussion protocol by like Tuesday or Wednesday this week and play in this week's game?
Without seeing him, of course, I didn't see him. I don't know. But based on how my practice runs and what I've seen in the past, my cases, and we quit counting after 10,000 cases. But there would have been a good chance that he could have been cleared by Thursday. And I'll give you an example. There's a high school football coach here in Ohio, which is right next to us, named Jose Davis, and a lot of people may never heard of him, but he was a two-sport star at Kent State. He was a quarterback for Kent State and played on the basketball team, and he had a long career in the Canadian Football League as a quarterback, and he coaches here. And he was losing players because their protocol in Ohio was once they were concussed in a Friday or Saturday game, Monday they took an evaluation, a test to evaluate, and he said he usually lost his players for 2 to 4 weeks. And so once he actually referred his son, he brought his son into me because his son had a concussion.
Right.
So he learned all about what we do. And I have a 4-day intensive program with the patients in my office for about 3 hours, and they get treated every 20 minutes. And it's intense, but it seems to do, it does do the job. But anyway, Jose started not allowing the patients, his athletes, to take the test until Thursday, and he actually would drive them to my office himself. And so I would treat them Monday, Tuesday, Wednesday, Thursday morning, and and they would take the test. It's called an impact test, which the NFL does use. And in the last 6 years, I've only had 3 cases that we had to hold out for one game. Everybody else returned to the game because they, on that Thursday, would pass the test and got cleared to play. Now, this worked well for a couple of reasons. The problem got treated immediately, which increases the chances of success. Every action has an equal and opposite reaction. So if you get a fresh injury, you can resolve it quicker. Now, if somebody had 5, 6, 7 concussions over the course of 15 years, that's you can help them with the 4-day treatment, but they may not be cleared.
Right.
But in the case of Tom Savage, the likelihood would have been probably pretty good that he would have been able to play this weekend.
So why do you think it is that NFL teams, you've been doing this for 30 years and you've got a ton of players, I won't mention their names, but you have a ton of players around the NFL that seek out your treatment. You have other professional sport franchises that seek out your treatment. And I also remember a report I read on a baseball team that you performed this on the baseball team, and I'll let you speak to how drastically their batting averages improves, because you said it helps with eye tracking and so many other different benefits to this. So I'll just ask you to speak on the study you did with the baseball team and how that improved, and also why do you think, with the CTE issues that you talked about and with how you can get these players not only back quicker but back and playing better, basically resetting some of these issues that they've suffered through high school, college, and now into the pros. Why do you think the NFL hasn't fully embraced this?
I don't understand it. It's been the results have been the same for 30 years. We've done a study, a research study with Duquesne University. I was in the early 2000s. I was on staff for their basketball team under Coach Danny Nee. And Danny Nee, interestingly, said, well, if you're increasing somebody's brain function, your brain controls everything from cognitive functions such as reading and memory and eye tracking to coordination issues, correct? And they said, yes, that's correct. So he set up a study with the help of his assistant coach, John Mahoney, who I think's coaching somewhere in Florida at this point. Anyway, they did a real simple test. They measured the players' vertical leaps and standing broad jumps, and his assumption was if these players had head injuries, which the majority of athletes have hit their head at some time, and they undergo this treatment, that we should see improvement. Well, they did. Post-treatment, after 6 weeks, there was an average increase of the verticals and standing broad jumps of about 4 inches. Now, it was a simple study, but there's similar studies too that prove what we've done. I mean, the increase in grades and everything. But what you're talking about as far as sports, essentially, your brain sits on a cranial bone called the sphenoid bone, and the sphenoid is very important because it's the only cranial bone that all of the other cranial bones articulate with. In other words, they all create a joint and touch it. And it actually moves up and down as you breathe. Well, the lesser wings of the sphenoid are in the roof of the mouth, and the sphenoid makes up part of the orbits of the eye, so your eye muscle is attached to it. So if the sphenoid isn't moving properly and it's kind of askew, some of the eye muscles will become elongated, some will be shortened. So it's going to affect eye tracking. Now, what does that mean to everyday life? In school, you're having a hard time following things with your eyes. So in school, you might reread the same line over and over. You may skip words. You might get very tired if you read. It can cause learning problems. On the baseball field, you're not going to see a baseball pitched to you as easily. You're going to lose it. A quarterback isn't going to see his receivers as well. That what the study you're talking about, there was in the objective study, there was a boy locally who, and I can't think of his name. If I mention a patient, it's because I have permission to talk about him. But he's in the research study, and he just got drafted in the pros this year. But he had a concussion, and his batting average dipped to 200. And anyway, so he went through treatment, and he finished the year. He had no home runs. They were halfway through the high school season. And then he finished the second half of the season with 7 home runs, and he finished the year with batting 396.
Wow.
And that includes all his bad at-bats. So
before the treatment.
Essentially after treatment, he hit over 600 because his eye tracking was working, and it was corrected. So, it has such a profound effect, and I've had a lot of discussions. Where the NFL players seem to be most interested is once they retire, because they start seeing problems and they get scared. It's very sobering to have these guys, come into the office, and then you'll see a big a man who's a proud man, break down because of the problems they're seeing. They leave. I had some Cleveland Browns that were telling me they would leave their house and couldn't find their way home. And so, that's all correctable. So that's when I got messaged by Manu Tuiasosopo. Did I say that right?
Close enough.
And he said he's trying to get me in touch with the NFLPA and the retired players because of the issues they're seeing as they age. And that's the young players that are active, they're, first of all, young men are invincible.
Right.
Secondly, they go the company line. So how they, whatever the team tells them to do, that's what they're going to do. Very few people think outside the box.
Yeah, that's a shame. Sounds like most people are doing it after it's gotten so bad to the point that they're just hoping for something to work and finding it by themselves. And then the former NFLers that I've seen and I've talked to and some of the stories I've read about, I think people would be blown away by all the success stories out there. And at some point, the NFL, I believe a team's going to take advantage of the opportunity. What you have, and what I've seen with my own eyes, is a legal cheat code that can give, in a game of inches, that extra bit of a nudge to put some of these teams over the top. And I think some team will take advantage of that, and we're talking about within the next year or two, and realize that instead of these people getting to the point where it's so bad they have to reach out and seek help, that people will start looking at as a preventative treatment, and we'll see players playing at some of their all-time best and all-time high. Let people know, not only the athletes out there listening, or high school, college, or NFL, but even the average everyday people. Myself, I came up there and got treatment from you last year. Decision that I don't think I'll ever regret. I mean, something that I had to have, and I saw the change immediately. And you could see in my eyes, you speak about some that I tracked and some of the glaze and different things over there. So go ahead and let people know where they can find you and how they can get in touch with you if they want to find out more information.
Well, they could. My website is Simkovich Cranial Institute. And Simkovich is SIMKOVICH, SimkovichCranialInstitute.com. Or if they just Google my name, the site comes up. What I don't understand is if it's such a win-win situation for the NFL and the players. You know, you'd have a situation where, you know, the owners protect their investment in their players.
Absolutely.
And they also allow their players to perform the best they can be. I mean, the NASCAR has a pit crew to make sure that that machine is running as well as they can. And you would think the owners would want, and the coaches want the same for these players. You know, for the players, it means elongating their career, increasing their earning ability. And really for the NFL itself, it would go a long way in helping a really devastating problem go away or lessen to quite an extent. You know, they just kind of look the other way, and it's a shame because it's very you can deal with it in a big way.
Yeah, absolutely. Dr. Simkovich, I appreciate you being so willing with your time. Love the work you've done. 3 decades of success. I tweeted out a video of Roy Jones Jr. and the benefits he saw from your treatment. There's many other people. Make sure to check out Dr. Charles Simkovich to get any of the questions that you may have answered. And if there's something you're dealing with, maybe this is the solution for you. It absolutely was for me. Dr. Simkovich, I thank you for your time.
Jason, is always a pleasure.
All right, thank you.